Hello, how are you everyone in Australia and America, of course, because it's all about both of you. I've ended up tonight with the wonderful Elizabeth Thornley. The two of us are hiding out, not in a bunker, but there is a tornado and we're sort of, well, it's passing us really, you know, it's just on the outside of us, but we found refuge and lots of love in a beautiful, beautiful space here in West Clifford, I believe, in Pennsylvania. And Peter and his lovely wife Brenda own this beautiful place, and they've built this beautiful place. I thought I'd introduce Peter to you all and share a little bit of a interesting story that you probably didn't think we were going to cover about medical negligence and a whole pile of messy things. So first we'll start with the wonderful Peter. Thank you for joining me here, Peter.
Thank you for joining us. It's a pleasure to have somebody, you know.
Yeah, it's great.
Of your stature to come and visit here.
It's wonderful to be here with you. You're wonderful, and you've built a lot of this by hand yourself. This beautiful space, I understand. You've put in a lot of blood, sweat, and tears, and it's just been gorgeous. What year would you say that you started here in the mountains?
Well, we moved here in 2000. It was January 1st. I remember. So I mean, we're basically here now for 14 years.
Wow, 14 years. And what, I believe just recently you've moved into the home, so it wasn't 14 years in the home.
No, we homesteaded down. I built a barn and we lived in our travel trailer in the barn for a number of years with, you know, full amenities and all, but it took a while for us to clear the property up here and get the place suitable for building.
Yeah, a lot of hard work. What's the size of the property here that you've got?
We've got 18 acres.
Okay, 18. So that's nice. That's it. Yeah, it's nice, isn't it, Elizabeth? Would you like 18 acres?
I would love 18 acres.
Especially in the endless mountains, yes?
It's beautiful here.
Yeah, it's, with all our neighbors having 100 plus acres, you know, it's we seem like small fries here, but it's big enough.
It's beautiful. And you've got like beautiful deer, a family of deer. And
bear. We have a fox living at 100 feet from the house, so it's sort of like Wild Kingdom here, you know.
Yeah, it's
away on safari.
It is, isn't it? It's gorgeous. So if you're ever in the area, Pennsylvania, Clifford, the mountains, the endless mountains, you've got to pop in and, you know, just it's a beautiful space. It's very, very healing. I wanted to talk though about something that happened to you. We're talking about which year? It's October, 2008, 2009, something like that. Because I've had a few issues here with just myself with my health, just mildly with regards to sinus and things like that, and it brought up that whole issue of your medical system here and how good it is and how secure it is for you. So what happened 2007, 2008, or maybe even 2009? It's all a blur because of what the poor man went through. But tell us your story, what happened?
Well, we heat with wood. Having 18 acres of trees here, it's logical to heat with wood. Most people around here do so. And like everybody else, I was trying to fill the wood shed by Thanksgiving. But it was getting late in the day. I was working alone with the wood splitter, and then somehow, I still to this day can't figure out how it happened, but I lopped off half of my thumb.
Goodness.
Yeah, it was, well...
So you took the whole half of the thumb off? The whole...
Right there at the joint. I didn't even feel it. And that was the most amazing thing. It was the blood all over everything that tipped me off that we had problems.
Yeah, so no pain that you felt at that in that moment?
No, it was remarkable. I don't know why I didn't feel the pain.
Yeah.
You know, but I mean, right up to the point where I was in the hospital, I still didn't feel pain.
Yeah.
Yeah. So maybe it was adrenaline or shock, I don't know.
The shock of it all. And so this was on this property, on this land, you've chopped it off, you've obviously seen it, you've located it. Did you place it on ice?
Yeah, I pulled it out of my glove and put it in a bag of ice and drove to the hospital. Fortunately, my neighbor was home and I stopped at his place and he did the actual driving, but
good.
It was a lost cause anyway.
Yeah. So you took it in ice to the hospital, and your local hospital's how far away?
Half hour.
Okay. And did they know you were coming? Were they advised?
No, I didn't do any phone calls of that nature. I was pretty sure at that point that they weren't going to be able to do anything anyway.
Okay.
You know, that they were not a big enough hospital to reattach, but my
Yeah.
concern at that point was more about closing up the wound so I could proceed.
Yeah.
Yeah.
To go back and chop some more wood,
Yeah.
because that's what you need when you live in the endless mountains. You need to keep warm, you need fuel, you've got wood everywhere,
For sure.
you know, and get back on with life. But also obviously infection, that would have been a concern. You don't want to get an infection.
Absolutely.
Yeah.
I mean, we unfortunately didn't have insurance. No health insurance. Being
Okay.
self-employed, health insurance in this country is astronomically expensive. You know, I had no one else to chip in, I guess, as a partial payment, which most people who have a job, the employer pays part of that as well, if not all of it. But
Right,
no.
okay, I didn't know that. So,
yeah,
yeah, okay, I didn't know the employer pays part of your health insurance. Yeah,
either pays
yeah.
part of it or all of it.
Well, okay.
You know, if it's a big enough company, it's part of the benefits. But
Yeah.
you know,
Because I've heard some really scary stories where people have said that they've literally fallen outside of a hospital, they're quite ill, they've fallen down or somebody's dropped them off, and unless they have insurance, they won't even see them. I've heard, and I don't. That's why I wanted to talk to you about this, because it's quite scary. So you got there, and
that, to my knowledge, is against the law.
yeah,
But on the other hand, I mean, you're going to be presented with a bill. You
Yeah.
know, and if you're a property owner or you have something of sustenance, you know, they can attach a lien or, you know, conceivably take it away if the bill is high enough.
right, yeah,
You know,
Yeah,
that's
so
why I could have had a helicopter ride to a larger hospital for reattachment,
okay,
but the doctor on the other end said that the prognosis would be slim because of the time involved. And I thought, quite frankly, I mean, I couldn't afford the helicopter ride. You know, all the extra bills and all, I mean, it's like,
so it's hard. I mean,
yeah.
you know, it's a terrible situation, and it's a thumb. But imagine if it was even more serious than that. Like, where would you stand if you haven't got insurance here in America? It's obviously quite serious. So you got to the hospital, and did they do anything for you? And if so, what did they cover? What didn't they? How were you received? Were you looked after?
I remember the hospital, the emergency room doctor telling me repeatedly, he had to repeat it 3 times because I couldn't believe what he was telling me. He told me that I needed to negotiate with the hospital to bring the price down, right? That I needed to talk to them because I was going to be charged full price, right? And insurance companies don't pay full price.
Right.
Hospitals overcharge, I guess, in order to receive enough money from the insurance companies
Okay.
to cover whatever they need to cover. And in my case, I would have been charged full price when I couldn't even afford the insurance, you know, so.
And all this is going on, and you've got blood all over you, and you've got a thumb in a bag on ice, and
Yeah.
you're still in shock. You've still got the adrenaline and everything's,
Yeah.
and all you're thinking about is money and finance, and how can I
Yeah,
manage this financially?
yeah, wonderful, yeah.
It's terrible, isn't it?
Yeah.
Because there's obviously the added stress of that it could have caused something else. You could have, you know, a weaker person in the sense, health-wise, could have had a heart attack, they could have had a stroke, there could have been a whole pile of other and psychological problems. And I've spoken to so many people about the mental illness in America here, and the people that are having injuries and going in for one thing and coming out with a whole pile of other issues because they're not supported by the system that's meant to support them. So what would you say that America can do to change this? I mean, because it seems to be across the board wherever we go, and Elizabeth and I have been in many states, and I've heard everything from the common cold. I had an Australian girlfriend come over, and she got sick just with an ear infection, and suddenly there was all this money and this talk of, and she had insurance, and they were still expecting her to spend a lot of money on top of that to get fixed. So it seems to be all about the mighty dollar and pushing a lot of products, a lot of, you know, off to the pharmacy and get this, that and the other that perhaps you don't even need. So how did you end up? You obviously, your thumb hasn't been reattached.
No.
So,
No.
yeah, did you bury the thumb and give it a send-off, or did you leave it with the hospital? And
No, they never even asked for it. They never asked for it. No, we have it disposed of here on the property.
yeah,
You know, I figured that was more appropriate place for it.
Yeah.
You know, not
Yeah,
that
because it's your essence, it's your bloodline.
the healthcare
Yeah.
system here sucks.
Yeah.
If you're a hardworking person, especially if you're self-employed,
Yeah.
you know, I mean, the system is stacked completely against you. You know, if you have no money or you have all the money in the
Terrible.
world, you
Yeah.
have the best system here for you.
Yeah.
But for the common Joe who's hardworking, you know, not so.
So it's coming down again to the mighty dollar, and it's all about the dollar. What do you think America, any president that's in power, whoever it is, the system itself, what do you think that they can do now for the people that can change things? I know that's a big question, but where could they start to help people like yourself in this situation? They need a massive overhaul, clearly.
I
'Cause there's-
don't know. Personally,
yeah.
I feel that, I mean, universal health care is overdue. You
Yeah.
know, this country should join the rest of the civilized world and care for the people who are providing them with their paycheck,
Yeah.
providing them with a means of being able to be a country.
Yeah.
You know, so I mean, I don't know.
Yeah.
I would say, you know,
Yeah.
universal health care. Some health care is better than no health care.
Yeah.
You know, with this Obamacare, the Affordable Health Care Act, it's not working.
Yeah.
We had a plan that we waited for a few years to get into that was affordable for us, right? It provided us with some health care, it provided us with some insurance, but because of Obama Affordable Health Care, it didn't provide enough, so that program got cut entirely. So now we're left with nothing again. Nothing that we can afford at this point.
Yeah.
You know, we own too much to go on any kind of a public assistance or you know,
That's
something
yeah.
that's supplemental, you know, and we're not making enough to really make it on our own.
To make it, you're in that catch-22, aren't you?
Yeah.
You're damned if you do and damned if you don't.
And we're in the gray zone.
Yeah, it makes it really hard. So I think America, you've got to do something about this because it's obviously everybody knows about it. Everyone's having bad experiences from situations. This man should have been helped and he should have been treated better, whether they could or couldn't have
Oh.
reattached the thumb. He
My
still should have
doctor
been treated
charged me
better.
for the amputation. He tried to charge me over, it was like $1,300 for the amputation itself.
Yet you amputated it here.
I brought it in a bag. You know, he cleaned it up a little
Yeah.
bit and they wanted the $1,300 for doing that on top of the extra.
Not
No.
good enough.
No, it wasn't.
Yeah, no, it's not good enough.
Yeah.
America, you've got to do something about this. You've got to change things because your people are growing. You're getting more and more, you know, your population is growing and there's a need. There's a real need to, and I know everybody talks about it, but something has to be done about it. Someone has to shift things because it's just not fair for, like you're saying, people that are working really hard, that
Middle
love this
class.
country as well.
Sure.
You know, you've got a beautiful country and beautiful people that I've met throughout everywhere that Elizabeth and I have gone. You know, there's some really gorgeous people from all walks of life and all, you know, demographics and financial circumstances. They're still good-hearted people, and I think everybody, from what I've experienced, love this country. They're very passionate and very patriotic about your country. So we need to fix the healthcare system. So hopefully our message in a little way will get it out there, and we thank you very much for spending our time together here this evening, and maybe we'll find some more magical things. We can always run off into the forest together, Peter, and we can change things. We have other ways.
That's good to me.
It's been wonderful to be with you, and thank you so much for your time here. And any messages at all for Australia?
Soon come.
Yeah.
Yeah. It's on my bucket list.
Yeah, absolutely. You're always welcome.
Well,
Yeah.
thank you.
You're always welcome, and your lovely wife Brenda, of course. Yeah. Peace, everybody. We'll see you soon.